Why do scars form? How long do scars last? And is there anything that you can do to prevent scarring? If you have deeper acne lesions, your body will attempt to repair them by forming new collagen fibers. These repairs usually aren't as smooth as the original ones, causing acne scarring. Epidermis gives a protective, waterproof layer and gives color, like one of those blue tarps that you can buy from the hardware store. The dermis provides most of the thickness and toughness of the skin, like the strong foundation of a building. And the basal layer continuously replicates, pushing dying keratin to the surface, like a skin factory. The epidermis allows for rapid cell migration to seal fresh wounds, but it also carries minimal strength. The dermis contains collagen, and through extensive cross-linking, it provides intrinsic strength, like a braided rope. The process of laying down the collagen requires much more time than the rapid process of surface closure. As we get into the discussion of wound healing, think of the wound as if it were a natural disaster. First responders are immediately sent to the disaster site. The goal is to save lives, not look pretty or repair anything. The next phase is reconstruction. Volunteers and others come to start the rebuilding process. The goal is to fix what was broken. The final phase is beautification. However, you're left with signs of permanent damage, like a scar. Wound healing is divided into several phases. The first is inflammatory. Initially, there's adhesion and aggregation. During this part, active substances are released, such as vascular endothelial growth factor, or VEGF. There's initial vasoconstriction followed by vasodilation. Reparative cells move in to begin the healing process. It's important to progress from this step as quickly as possible so that the wound may close and subsequent collagen deposition can begin. This process peaks within hours and lasts for about 1 week. At the end of this phase, the wound has about 10% of its final tensile strength. The next phase is the proliferative phase. The proliferative phase begins at 24 hours and it peaks at 2 to 3 weeks and lasts for months. This phase is characterized by epithelial regeneration, fibroplasia and collagen formation, wound contraction, and neovascularization. Epithelial regeneration is critical as it allows the reestablishment of the barrier to protect the underlying tissue from bacteria and other foreign material. A moist wound surface allows for better wound healing because the cells at the surface can migrate more easily. More on that later. Fibroblasts secrete collagen, which form into collagen fibers to help build strength. Contraction allows for wounds to close when needed, but it can lead to problems by mobile structures, such as the eyelid or the lip. The next phase of wound healing is maturation and remodeling. This lasts for about 12 to 18 months. The scar gradually becomes stronger and shows a decrease in size and redness. Collagen fibers become more organized. By the end of this phase, the scar has about 70 to 80% of the tensile strength of unwounded normal skin. Sometimes we don't have the best response team or immune system. This can lead to abnormal wound healing. You can have a contracted scar. That's when there's a replacement of the epidermis by thickened scar tissue. There could be a rolling scar, and that's when there's a depressed scar with irregular bands. There's also the potential for hypertrophic scars, or an elevated appearance to the scar. Another type is an atrophic scar, which is when you have a thin epidermis. And also there's a keloid. A keloid is when there's overgrowth of the boundaries of the original injury, and this tissue then invades surrounding normal tissue. There are various factors that can impede normal wound healing, and some of these include diabetes, hypothyroidism, malnutrition, immunodeficiency, radiation exposure, retained foreign bodies such as suture or other foreign materials, and tobacco use. And there are also many other factors that might make wound healing more challenging in an individual. So moist wounds heal better than dry wounds, and that's because it allows epithelial cell migration to occur more directly. On the contrary, if you let the incision dry out and scab over, what that does to the underlying dermis is that it then becomes more desiccated and actually partially necrotic, and that impairs wound healing and leaves a worse scar. It's hard for the workers to rebuild in a desert. The new immature stratum corneum, which is the outer layer of the epidermis, allows abnormally high levels of transepidermal water loss. This dehydration of the stratum corneum signals the keratinocytes to produce cytokines, which are signals to the fibroblasts to then synthesize and release collagen. The newly formed collagen rushes to the scar site. Silicone replicates the stratum corneum's occlusion properties, normalizing the hydration of the scar site to that of healthy skin, inhibiting the instruction sent to fibroblasts to produce excess collagen.